you're going to set a pressure. This machine is then going to endeavor to deliver that amount of pressure into the patient's lungs. You're going to set a pressure, and you're going to set a flow in liters per minute, at how fast you want that gas to get into the patient's lungs. As I also said, you have an air mix, which you can do 100% gas source, which is, if you're on oxygen, it's going to give them 100% oxygen, but if you're in the air mix mode, it's going to suck in some room air. On the ambient side of the machine here, you'll look really close. There's a thing here that looks a whole heck of a lot like a Venturi. It actually is. Your gas source comes down to the center body. It will come up through your ambient chamber where room air is, and as it's going through here, it actually acts on the same principle as a Venturi and mixes room air with the oxygen. But as I always said, your FiO2 is guess your best. You have no way of knowing what FiO2 you're actually giving your patient.
Really?
Really. That's why most of the time, if they use this, if the patient is not on oxygen, they will get it on room air, if at all possible. You have a sensitivity device. Sensitivity is how hard or how difficult you want to make it for the patient to trigger this machine and take a breath. You want to make it as easy as possible without having the machine do what they call self-cycle. If you set it too sensitive, the machine will just start going really, really fast. You don't want it to do that. But you want it easy enough so the patient doesn't have to work hard to get a breath. Because when the patient sucks in a little bit, the machine senses that and then pushes the air into their lungs.
And you said, I'm sorry, you said that where?
This is here. This is the sensitivity. This side is the pressure. You're going to set your liter flow. Now, this button was used to set a rate if and when it was used for mechanical ventilation. We very rarely, if at all, do that anymore, except in those areas where I was talking about before. But as you can see, there's actually there's numbers on here, but they don't really correspond with anything. You have to actually stand there with the watch and count the rate to get the rate you want, which makes it a very difficult thing to work with. The pressure that you generated is going to be shown on your pressure manometer. You can use this device with a mouthpiece. If the patient is lucid enough to hold it in their mouth, you're going to tell your patient, first you're going to do a complete assessment. And part of that assessment will be getting a tidal volume, maybe a minute ventilation to see how well, a vital capacity, to see how well your patient's breathing. You're going to tell them that you want them to just suck in a little bit to trigger the machine and then to relax and let the gas blow into their lungs. And then, as I said, when it finishes to fill in their lungs, exhalation is going to be passive. You can do it with a mouthpiece, or you can attach a mask, and you can actually put the mask on their face and use it that way.